First of all, please remember, this is not replacing the practice of veterinary medicine. It's also not intended to represent it. And what you are hearing here is my personal experience from my studies, from my field experience in nutrition and horse health coaching. And the content here is copyrighted. We often ask ourselves, do supplements actually work? How do I know if they're working, and does my horse need them, and where do I start? It would be nice if they had a tracking number, right? I got a package delivered today and I knew exactly when it's going to arrive and where it's going to go to because it had a tracking number. So what I'm trying to do is I'm trying to really kind of figure out a way how I can give supplements tracking numbers to really figure out, do they actually arrive where we want them or we wish them to work? And to answer the first question, do they actually arrive in your horse's body? And if not, how can I make the supplement bioavailable or more absorbable? You have to know a little bit more about your horse's digestive system. And I'm going to be addressing here two particular issues. The horse, the species horse, is about 50 million years old. And it has only been domesticated over 5,000 years. What that means is actually that for almost 50 million years, whatever the number is, 50 minus 5,000, 50 million minus 5,000, it is relying, or has been relying on fresh nutrition, on unprocessed feed. And the difference between fresh plants, grass, anything that the horse can eat from nature, and compare that to processed food, the difference is that the processed food is pelleted, pressed, heated, and in that process, something dies. In that process, a central element in each plant dies. And what that is it's the enzyme that in nature helps reintegrate the plant or the grass into the soil, right? When you watch a leaf fall off the tree and it will wither and it will reintegrate ultimately into the soil. That is actually done by enzymes. And when you take this fresh stuff into the body, that enzyme is still alive as long as you eat the stuff fresh. But if you cook it, like in eggs, for instance, we know from the eggs, they denaturate, right? When you boil an egg, it changes its consistency. The protein, enzyme structures are protein, it will denaturate and it will become ineffective. Now, let's go back to evolution. The horse has not had a chance to install a new gland since domestication, to install a gland specifically for enzymes that are suitable to digest the processed food. So where do the enzymes come from? Basically from nowhere. Your horse does not get enough digestive enzymes from the food because it's processed food. Hay is dried grass. The grass enzymes are dead from the heating and drying. The bucket food doesn't have any natural digestive enzymes because there's usually nothing fresh in the horse's feed bucket. Leave aside the occasional carrot or the apple, which a lot of people poo-poo now because they say, oh, that's too much sugar. But if you give your horse fresh stuff, this is where the enzymes are contained. Any other bucket feed, anything processed, any pellets, whatever it is, do not have any active digestive enzymes. We're going to be talking in a moment exactly what enzymes are, but let me just tell you this. You see this diagram of the horse here. Enzymes are responsible to make food bioabsorbable in the small intestinal tract, in the so-called foregut. Okay, anything here, this is the foregut and stomach. In this part, everything gets digested that has to do with fat protein, and carbohydrates. And if, for instance, the so-called starches, the carbohydrates, do not get absorbed in the foregut, they will reach the hindgut and produce laminitis here or hindgut ulcers because they are not supposed to get into the hindgut, into the large intestinal tract. So we are all worried about, oh my gosh, we cannot give our horses starch because it will go here. No, actually, the starch can be absorbed here if we add amylase. Amylase stands for starch, amylase to the horse's bucket. We're actually enabling a large amount of starch to be absorbed in the foregut. Same with protein. The protease will help protein to be absorbed, and the protein is important for muscle building. Amino acids are protein structures. They're important for skin health, immune system. Everything in the body needs amino acids. If there is no protease in your horse's bucket, the amino acids cannot be absorbed or only very limited. Lipase for fat, lipase, lipids stands for fat. If your horse gets oil and you don't add lipase to the food bucket, most likely that oil will go into the hindgut and you get hindgut problems. And now the whole industry focuses on hindgut ulcers and on problems here instead of addressing the root causes. What happens in Vegas stays in Vegas. What happens in the foregut should stay there. Here, we should enable the horse to absorb the nutrition in the foregut. So when I say fat, carbs, and protein, I'm talking about any even low carb, low starch senior feed. Whether anything basically except grass hay that is absorbed in the foregut. Anything except fiber, which is digested back here. This is the point where probiotics come into play. This is the point where enzymes come into play. Everybody talks about, oh, my horse needs probiotics. Yes, your horse also needs digestive enzymes. Your horse cannot absorb the supplements without digestive enzymes. So before you ask yourself, which kind of supplements does my horse need? You need to make sure that whatever supplement you choose, that your horse can actually get that into the body, because the process of absorption is getting the food from the gastrointestinal tract through the gut wall into the body. So the food will go into the gut and then get through the gut wall into the bloodstream, and the bloodstream then brings it to the body. This is where you want to see the muscle development, the shiny coat, the nice hoof growth. That is all body. Here's another interpretation and illustration of this because it is so incredibly important. Protease is for protein absorption. Any alfalfa has two parts, the alfalfa fiber and the alfalfa protein, as in the leaf. The alfalfa leaf gets digested in the foregut. A lot of people say, oh, alfalfa will make my horse hot. Not if you enable alfalfa absorption in the foregut. The horse will get uncomfortable and gassy if you allow the alfalfa to be passed through into the hindgut, because any protein that enters the hindgut will produce problems with those probiotics because they don't know what fat and carbohydrates and proteins are. They can only do a few things, and one of them is cut the hay fiber into little pieces. But they don't know what all the stuff is here coming from the foregut. They don't do well with starch, protein, and oil and fat. The amylase starts absorption. I can't talk today. Anything metabolized with the help of insulin, right? Insulin is a hormone that gets released from the pancreas, but insulin will not make up for the lack of enzymes. There are a few enzymes that get released with the pancreas, or the question is also, what about the saliva gland? Now, in horses, when a horse licks you, you can notice that the saliva is very watery, right? Compare this to a dog. when the dog licks you, it's kind of slimy. It's an odd comparison, but why that is because the dog saliva has a lot of meat digesting enzymes in the saliva gland, but the horse does not have any enzymes, or just a small neglectable amount. The enzymes that can be produced in a horse are just enough to eat a little bit of stuff that evolution assumed would be okay, right? Remember, the horse has not adjusted to captivity or domestication. The saliva gland here, the parotis, produces mainly bicarbonates, buffers, to buffer the stomach acid. This is, by the way, why it's so important that a horse chews accordingly so they can buffer the stomach acid, the excess stomach acid. So there's no place in the horse that produces enough digestive enzymes. The saliva gland, the parotis will not do it, and the pancreas neither. The next question is, how much of a supplement do I need to give my horse? First of all, here's just one plain example. It really depends. Let's grab biotin, for instance, right? It used to be 20 milligrams per dose. Now, the industry thinks that 20 milligrams is way overshot. Maybe we can do with 5 or 2 milligrams. I'm not sure how this came up. I can just tell you from my nutritional practice that 20 milligram per day is okay for maintenance. But if you have a problem with your horse's hoof and you need more heel growth, you need more hoof structure, better hoof structure, you will need to crank that up to about 50 to 60 milligram per day for about 3 to 4 months until you have your horse where you want that hoof to be. And then you can go back to 20 milligram per day. Unfortunately, most supplement makers will give you the biotin amount per pound. And you look at the number and go, oh, there's 120 milligram in there. Well, read it's per pound. So then they leave it up to you to do the math. Same with parts per million. Unfortunately, labeling is not transparent in the industry. And that is what I call deceitful marketing. But if you have any questions, you want me to translate a label, send it to me. And then I can tell you how much of the stuff is in it, or I can better even I teach you how to do it. And that would be actually something that I would teach in this class, right? How do we figure out what supplement is good and what it isn't? So maybe I should set up this class soon. Now, the next question is coming back to the absorption rate, right? So we had enzymes that will help absorbing the nutrition and medication, by the way, too, and supplements. But then in itself, how bioavailable is the supplement itself? And here's something very important, that minerals in particular, they usually come with the first name and the last name, right? So one part is the active form, and the other one carries it somewhere. It's combined to it for stability, and so forth. So magnesium, for instance, there's a lot of magnesium supplements that advertise muscle relaxation or mental relaxation. But magnesium has a clinical threshold in the horse. So for, let's just say, 1,000 to a 1,200 pound horse, you will need about, at least, depending on how anxious, how muscle tight your horse is, anywhere between 15 to 30 gram per day. That's translated in pure magnesium powder, about anywhere between 1 and 2 tablespoons per day. But if you use an inorganic formulation, such as magnesium oxide or magnesium citrate, when you crank this up to the amount that it finally might relax your horse first will get gastrointestinal upset or diarrhea, because you might have seen this magnesium oxide or citrate is used as a laxative. Milk of magnesia is magnesium citrate. So what you want to do is you want to go with what we call chelated form. Chelated means it's an organic composition, And the organic compositions are more bioavailable. That means they don't go through the hindgut and produce a problem. They get absorbed easier in the foregut and are actually available for what you want this muscle relaxing supplement to do. Let's talk about some supplement categories. Let's talk minerals first. Minerals are the most neglected supplements there is because nobody ever talks about them. I work on minerals, and the problem with minerals is when you have a mineral deficiency in your horse, you do not notice this right away. When you have an oxygen problem, heck yes, you will notice. When you have a water problem, hydration problem, you will notice pretty soon. You have a protein problem, within 6 to 8 weeks, your horse has lost all top line. When you have a mineral problem, it takes months and sometimes years to create this problem, manifest this problem. By the time the problem is there, you will not connect it back to the original root cause unless you do a certain testing, right? We'll talk about this. Mineral deficiencies vary throughout the United States depending on the soil pH. I presented on this last week in my mineral presentation. The video is on YouTube as well. I'm not going to go into detail here, but does my horse need a certain mineral? The answer is, I don't know, but you can find out with the hair analysis. When you transport, for instance, your horse from one of the dark areas here into the light green areas, out of a sudden your horse might become extremely mineral deficient in certain minerals that are not prevalent in those light green minerals with the low soil pH. Here, for instance, right, these minerals need a certain pH. Does my horse need minerals? Well, if your soil in the hay was balanced with the pH at 7, that's an indicator how alkaline or acidic your hay is in the soil. You see that most of these minerals here, look at my arrow go, most of these minerals are in the hay or in the soil. But when the pH goes down, you see here that there's only one mineral that gets predominantly absorbed into the hay from the soil and into the pasture grass, that's iron. So regarding minerals, it depends if your horse needs a mineral supplement. You usually cannot see this from the outside, but if you have a chronic problem with your horse, there's usually a mineral deficiency involved somewhere. How can this look on the outside after you balance your horse and minerals? This is the difference before and after, 6 weeks in between. Naturally, the horse is supposed to be black. Look how this horse looks on the left side. Hoof growth, right? This was a case that had been diagnosed with a genetic disorder. Well, this hoof problem occurred when this horse was in his teens and had never had a problem before. And then they called it late onset. Well, we put it on a mineral supplement after we'd hair tested, and a few weeks later, the hoof was okay, right? This was called coronary band dystrophy, genetically produced. Well, if it's genetically produced, it would not heal because it's genetic, but it wasn't, has never occurred again, ever after in this horse. The question now, is your horse mineral depleted again? You can send me a hair sample or send it to other laboratories. Remember, some of them, they just give you, they don't give you the original lab test, they give you an interpretation of it and throw the most important part away. So be a little bit conscientious about where you send your hair to. Here's an example. This is an example of a horse that was very low in gastrointestinal absorption. So what we can see here is not only the minerals per se, yes, that's what you see, but if the minerals are not being absorbed, what we do here is we compare what goes into the feed bucket, and then we compare what arrives in the body cell, because the hair is a reflection of the body cell. The body will distribute minerals non-selectively to the body. So whether we take a muscle biopsy or we take a liver sample or hair sample, the amounts are the same. So the hair is very convenient, can be sent in the mail, doesn't get old that quickly. And minerals also do not show well in the blood testing, right? Minerals get shoved away into the tissue, and this is why heavy metal toxicity is not recognized and is not visible in the blood. Heavy metals are also minerals. So when you look here at the reference range, the minerals are supposed to be up here. It's all very low. And this can be a horse that has an ulcer. It can be a horse that has parasites. The parasites will eat all the minerals. Parasitic infestation often also leads to very low phosphorus levels here. For some reason, parasites appear to have an increased demand for phosphorus. How does oversupplementation look like? Looks like this. You can oversupplement in minerals. There can be mineral toxicity. And it's not so much the mineral itself, it's going to be the antagonistic nutritional mineral that's going to be pushed out of the body. So you don't necessarily get a problem firsthand from the excess of the mineral. You get, for instance, here, right, we have an iron overload. Fe stands for iron. It will inhibit copper absorption. And when you have a copper deficiency, your horse will get joint problems, tendon problems, hoof problems, bleached coat, and all this stuff. So the minerals should be somewhat balanced. Let's talk about vitamins. There are two different sorts of vitamins: fat-soluble vitamins and water-soluble vitamins. Fat-soluble vitamins are A, D, K, and E. There's 4 of them. You just have to know them and remember them, that you can overdose your horse on fat-soluble vitamins. Every veterinarian usually recommends vitamin E, right? Because it can lead to neurological problems, E deficiency or muscle tightness. It's a good antioxidant, but you can do actually too much. Your first problem is going to be that maybe your horse gets blood that is too thinned out. And this is why before people go into surgery, the surgeons will always request, stop your supplements, stop the vitamin E, stop the camelina or flaxseed oil, the fish oil, because that contains vitamin E and it might thin your blood. And if you have a show horse and they perform and their blood pressure goes up, especially in race horses, you will see that the blood can get very thin. And I have learned this in my 2.5 decades working with race horses, that the horses can get lung bleeding. I had 2 fillies that bled through the Lasix. They were on too much vitamin E. So this is an example that we can overdo things, right? Too much of too good is also too much. Because those fat-soluble vitamins, they get secreted very slowly with the liver. The water-soluble basically get peed out the same day, right? They get secreted with the urine. Vitamin B, vitamin C, overdosing is unlikely. Also, a deficiency in horses is unlikely because those vitamins are made by the probiotics in the hindgut. So unless your horse has an extreme hindgut problem, you normally do not have to add vitamin B or vitamin C to your horse's diet. What would be examples for A, D, K, E? K is usually contained in fresh grass pasture, right? So if your horse is exposed to pasture grass or some spinach or some spirulina or some algae, kelp, that should cover that. Vitamin D usually comes from the sun, but horses appear to be like people. A lot of people have a vitamin D deficiency, or they don't absorb the vitamin D or don't make it in their body. You have to supplement. And I had horses that showed secondary indications for vitamin D deficiency. And there are sometimes we have to add some vitamin D. I use a sublingual vitamin D for those horses for a time, very conscientious about you can overdo it. Vitamin A, carrots, right? Our vitamin A sources, natural sources, are also pasture grass, helps. And vitamin E is in camelina oil, flaxseed oil. There are several industrial vitamin E. Remember, when you give a fat-soluble supplement, you should mix that with some fat, because the fat in the food bucket will enhance the absorption of those fat-soluble vitamins. It will make them more bioavailable, because the fat-soluble supplements need to be coated, need fat to be dissolved in, And the fat then needs to be transported with the presence of lipase and pancreas enzymes. So if you just give the scoop of the fat-soluble vitamin and nothing else in it, the pancreas might not be triggered to release some enzymes and digestive juices to make that fat absorb through the gut, right, through the gut wall. So A, D, K, E are best mixed with food. And this is when you eat a vitamin E supplement or vitamin D, it says, eat with food. And specifically eat that with some fat, like some oil or some peanut butter, or not for the horse, for you, I mean. So let's see. Next one, electrolytes. Okay, so here's another big one. A lot of people, especially performance riders, hopelessly oversupplement their horses with electrolytes in the thought that it will hydrate their horses, keep them away from muscle cramps, and do all kind of other sorts and stuff. And that's not true. In fact, if you overfeed your horse with minerals, electrolytes are minerals too, sodium, chloride, and potassium. If you oversupplement your horse with electrolytes, your horse will try to get rid of them, because otherwise they will disturb the internal electrolyte balance in the body, and really bad things will happen when that's going on. So your horse is forced to pee those electrolytes out, and those electrolytes have an osmotic pull. Too much down the rabbit hole here, but let me just tell you that they draw water. And what this will do, it will backfire on you, right? It will actually dehydrate your horse if you give too much electrolytes. Now, the potassium, if your horse gets any alfalfa, there's a potassium in the alfalfa, plenty. Potassium is in bananas, potassium is in some sort of grass. It's usually grass hay has 1-on-1 potassium and phosphorus in balance. But what I'm trying to say here is the main electrolyte your horse needs the most is sodium. So let's take a look at the sodium here. This is the most important electrolyte your horse needs every day. Sweat. Ever wondered why sweat dries white? It's because it's table salt. It's mostly salt, and this is why it dries white. See, here's the composition of sweat. Let's take 1 liter, or a good quart in American terms, of sweat, right? A quart. You can imagine a quart. So there's 3.5 grams sodium. That would be about, say, between 1/2 and 3/4 of a teaspoon. 6 gram chloride, right? But you never basically give chloride, never think of chloride in the electrolytes, but sodium chloride is plain table salt. So those two elements here, that's table salt, that's white salt. White compared to red salt, sodium chloride is white salt. Sodium chloride plus iron is red salt. The reddish color comes from additional minerals. And if your horse gets offered a mineral mix that has minerals in it that the horse doesn't need, it will not eat the salt. And then you say, oh, my horse doesn't like salt. No, you haven't given your horse the salt that it needs. So I recommend give your horse unrefined sea salt. So you see here that the sweat has about 3 times more sodium than potassium. So the biggest component in horse sweat is sea salt. This is why sweat tastes salty, right? I mean, you know this from yourself. If you have a good run and the sweat runs down your face and you taste a drop of it, it's really salty for those reasons. And this is why we want to give white salt. And here's another factor. Salt licks, although they're really pretty and they make great lamps, are really made for cows. Cows have a rough tongue. They're not as active as horses. They might not need as much salt. Debatable. I'm not a cow expert, but let me tell you this. I recommend that you stay away from salt licks, that you offer your horse a supplement. The sea salt is a supplement. You supplement your horse's food. You hang the supplement, the sea salt, into a bucket and offer it to your horse. Free choice, in addition to add at least 2 tablespoons per day into your horse's bucket. If your horse is 1,000 pounds, 2 tablespoons daily, plus a bucket for free choice. That is actually, next to the digestive enzymes, the most important supplement that should be in your horse's daily diet. That brings me to my take-home message. First, make everything bioavailable. Whatever you do, your joint supplements, your skin supplements, your hoof supplements will not get into your horse's body if you do not make that bioavailable. Digestive enzymes are enzymes. They are not probiotics. You have to look at the bag and find where it says lipase, amylase, cellulase, protease. A balanced macro diet can do a lot. For instance, protein, right? You do not need a protein supplement. If you give alfalfa and you give a little bit of soybean meal into your horse's bucket, that is all the amino acids your horses will need. I have a specific webinar on YouTube that's about half an hour about baseline nutrition, and I'm going to refer you to that webinar herewith. Most important supplement is white loose salt, and the need for minerals varies by location. If you want to know, have a hair analysis done and it will tell you. Vitamins A, D, K, and E can be overdosed, so be conscientious about that. If you want to know, they can be tested in a blood analysis. So I cannot see the vitamin deficiencies or excess in a hair analysis. That is something that your veterinarian would have to determine, especially D and E. I think the others can be determined too with specific testing if need be.